Okay, I think we'll go ahead and get started. I see people are still joining. Thank you everyone for dropping your name and your organization in the chat. I see we have a very nice representation from public health. And I'll just quickly introduce myself. I'm Therese Finn. I am the MDRO infection preventionist for the Oregon Health Authority's HAI program. I know quite a few of you on the call, and welcome. I'm very excited to be kicking off the Infection Prevention Power Hour, and this is primarily for Region 1, which is Clackamas, Columbia, Clatsop, Multnomah, Tillamook, and Washington County. But because we're having some changes in roles here at the HAI program for infection prevention, it will probably expand. So if you're not from one of those counties, we're extremely happy you're here, and does not mean that you don't belong. So and the goal here for the Infection Prevention Power Hour is really to build infection prevention expertise through our partnership and collaboration. So that's the purpose of the Power Hour. I will run through a couple of little housekeeping things, and then get this to work here. And then I'll go ahead and do a little more formal introduction of myself. But one of the things I want to talk about first is just kind of how to get the most out of this time. And as I mentioned, it's really about collaboration and partnership, and to keep in mind that we all benefit from each other's individual knowledge, experience, and wisdom. Don't hesitate to make comments either in chat or coming off mute. It's best if you can just minimize distractions so you can focus on what we're talking about, and then relax, particularly as it's really important for folks to feel free to contribute. So be fearless. Sometimes I can get a little shy and feel like a question I have might be stupid, but from my perspective, there is no stupid questions. So no matter how simple it might seem to you, don't hesitate to jump in and ask for clarification. And then also at the end of each session, each month, I will be sending out a feedback survey. And that's really important to me because the primary goal is really to provide content, conversation, and information that's valuable and makes people feel like this time commitment is worthwhile. So these surveys that I send out, be honest and straightforward and share with me and Claire. Claire is not here this week, by the way, but she will be joining us. That we really have some good information as to what you guys feel would be most valuable for you. A few minor rules for the road. I do want to make sure everyone's aware that our session presentations will be recorded. We will not be recording the open question and answer period, but I want to make these available for people who might miss the original timing. So we are wanting to record them. Remember, please, to be kind, courteous, and respectful to everyone, regardless of what questions they might ask. We really want to be able to dive into the detail. And very importantly, please engage, ask your questions, and then feel free to communicate to me and Claire in the way that's most comfortable for you. You can go ahead and text through the chat, you can unmute, you can turn your camera on or off. I love to see faces, at least especially at the beginning, so I can get to know people a little bit better. And then if you have questions that aren't resolved and we run out of time, please feel free to send follow-up emails. So I want to start and tell you a little bit about myself for those of you who don't know me. I joined Oregon Health Authority's HAI program as the Region 1 infection preventionist back in October of 2020. So I've been with OHA for about 4 years now. In October, it will be 4 years. And I was part of the pandemic support IP team. Starting in May and officially on July 1st, I transitioned into a new role, and I'm now the Western Oregon multi-drug resistant organism infection preventionist. So I have a role in MDRO preparation for facilities as well as response, pretty much on this side of the Cascade Mountains. From my infection prevention background, I've been in IP since 1993. I kind of find that hard to believe sometimes when I think about it, but yeah, I've done this for a while and I love it. And most of my career was spent in the inpatient acute care setting for about 28 years. And I've had lots of experience in really the basics and some more unique aspects of infection prevention and control, but surveillance, surgical services, long-term care settings, ambulatory care, cleaning, disinfection, and sterilization is a particular area of interest and experience for me. And also have worked with a number of organizations in program development. So how to establish the foundations and develop your infection prevention program. And so now I've been in public health for 4 years, and I plan to stay in public health as long as they want to keep me here. A little bit about me. My husband is an Aussie. Between us, we have 4 children. I have my daughter, that's a picture of her on the left. Her name is Carly, and my son Chase on the right. I love them both dearly. And then that little furry creature in the middle is a newest addition to our family, a little fur baby, Winston, who turned 1 on Tuesday. Yeah. And we all live in Washington County. For fun, I like to golf. So that's me trying to hit a ball on the left. I'm not very good at it, but I do enjoy the walk. I love to garden. My husband and I usually go to Hawaii a couple times a year, once or twice a year, to refresh and regroup. We like to play pickleball, and I love to travel. This picture here is an image of out the hotel window in San Gimignano in Tuscany. So a real favorite memory for me. So like I mentioned earlier, Claire can't be with us today, and I did want to just introduce her briefly. I'll let her tell you a little bit more about herself when she joins us next month. But Claire joined OHA in 2024. She started her role with PSET as the Regional All Hazards Epidemiologist. I'm not really clear on the acronyms, so I'll let her sort of explain that a little bit more, but she's sort of my partner in crime here when I work directly with those of us in Region 1. She joined OHA in 2021 as one of the epidemiologists for the CREW pandemic support, and she has a background in epidemiology in local public health and at Good Sam Hospital. She has some background in laboratory and veterinary experience. So we'll look forward to hearing more from Claire about her experience. She wanted to share that she lives with her boyfriend, but I actually don't know his name, so I'll have to save that for a question next time. And then there are 2 fur babies, Austin and Tanner. And then Claire likes hiking, camping, foraging, photography, painting, travel, music, food, football, and UNC basketball. So that's a little bit about Claire, and we look forward to having her join us. So as most of you probably know, and I am thankful and appreciate your response to the survey that we sent out about what kinds of things you would want to hear from. And just for your information, the top presentation topics that were selected were infection surveillance practices, emerging pathogens of concern, IP professional development. And actually, since I should have corrected this, but I didn't. I think one of the fourth higher one was enhanced barrier precautions. So we will be including that in our repertoire in the next coming months. And then also preparing for respiratory season. Some other popular topics were, germicide selection, waterborne infections, which also can have a very strong link to emerging pathogens. And then a respiratory protection plan. And then I'm very interested in devices from an HAI perspective, but that wasn't as popular with everyone else as it was with me. So we'll probably leave that for a bit later. So as part of our proposed schedule, or this is a schedule that Claire and I have put together. So we'll be meeting on the second Thursday every month. Today on July 1st is our first. And the purpose of this meeting is really meet and greet, talk about where we are, where we want to get to. And then also, we're really fortunate to have Ryan Frick join us to tell us a little bit about some some vaccination resources that are available for long-term care settings. So he's going to round out our meeting presentation, and then hopefully we can open it up at the end of the meeting today to talk a little bit more about needs and wishes for those of you who are going to be participating. In August, we will be talking, our focus presentation will be on respiratory season. And Claire is also has done presentations on wildfire safety and respiratory protection. So she's going to be doing a separate presentation on that in August. In September, we are going to do our first program session on emerging pathogens. And I like to call this one Watch Your Carbs, or your carbapenems. So we'll be focusing primarily on CRE, or carbapenem-resistant organisms, and more focused on carbapenemase-producing organisms, which is a real area of focus and concern for us here in Oregon. In October is, in case you don't know, October is Infection Control Week, and it is actually happens to be the week that we will be doing our Power Hour. So what I would like to make that the focus of is infection prevention professional development. And if you have specific questions about that, it would be great to have you send them ahead of time so that I can make sure that I'm addressing what it is people are most interested in developing your IP expertise. Then in November, we're going to have our second emerging pathogens presentation, and that will be focused on Candida auris. And that's something that we're really starting to experience a little bit more of in the state of Oregon, and it's important to be prepared. And then in December, I really want to focus on infection surveillance practices and how to make a business case based on surveillance data that can protect your infection prevention time and activities when we're able to provide data to administrative folks, C-suite folks, as to how strengthening infection prevention programs can really be a value added to the organization. So I'm excited about that, and hopefully through that program, you'll be able to actually build a foundation. I have some great tools that I'm wanting to share to build a foundation to track specific infections in long-term care and attribute lost dollars of revenue to infections. So it's kind of making a business case for infection prevention. So that's what we'll be talking about in December. And then in the next couple of months, based on how things are unfolding with the group, then we'll come up with the next 6 months for for agenda items that people want to hear us talk about. So before I turn it over to Ryan, is there anything that anyone in the group would like to chime in or put into the chat in regards to what I've talked about so far? And I'll give you a minute to respond. I got to get comfortable with silence. Okay, so with the silence, I am going to go ahead and move on to Ryan Frick. And Ryan is going to talk about on-site vaccination clinics. And I am going to let him tell you a little bit more about himself and what it is that he does and what he's hoping to accomplish in the next few months before respiratory season hits us. Thank you, Ryan.
Great, thank you so much. Thanks for having me today and for giving me this time. So my name is Ryan Frick. I'm an epidemiologist with the Population Health Team for Oregon's Department of Human Services Aging and People with Disabilities program. And I am here today to talk about our program's efforts in essentially advocating for the scheduling of on-site clinics for APD licensed long-term care facilities for the upcoming respiratory season for 24-25. So I started in this role in January of this year, and I am in charge of, or kind of overseeing our infection prevention and control work specific to vaccinations, and then some work in antibiotic and antimicrobial resistance. That's something else we're looking at. Really, our team at ODHS is tasked with kind of advocating for the safety of long-term care residents in the state of Oregon and in our APD licensed facilities, so NIFs and CBC facilities. And vaccination is something that has become important to us as we've navigated the post-public health emergency environment, and as we've seen some of the trends in vaccination rates in our facilities over the last couple of years among staff and residents. So that's kind of what this effort has been born out of. And it's something that we hope to continue on into the future. So that's what I've been working on. So this is our kind of, really, it's a public health outreach campaign advocating for on-site vaccination clinics for our licensed facilities. So I will introduce this effort. So on the next slide, here I have a short description of needs. So like I said, Aging and People with Disabilities has recognized the need to allocate more staff and resources to kind of advocate for vaccine uptake efforts in our licensed facilities starting this year. This became apparent after we noticed that there's been kind of year-over-year decreases in vaccination rates in our facilities for both residents and staff. Here I have some basic stats that kind of illuminate that. Currently, as of May, we had about 25% of residents in our licensed facilities that were up to date with the most recent COVID-19 vaccine booster. So now the definition of this is residents who have received 2 doses of the most recent COVID-19 booster. And our staff number being reported is currently 12%. So the AARP Long-Term Services and Supports scorecard has Oregon ranked as 33rd for residents and 13th for staff with those numbers. We saw around 60% of individuals aged 65 and over received the flu vaccine during last respiratory season. That group remains still the most willing to receive the annual influenza vaccine, at around 60%. That has kind of remained steady throughout the last 5 years. And we saw around a little bit shy of 2/3 of eligible healthcare workers were reported as receiving the influenza vaccine during the 22-23 respiratory season. So some background contextual information about APD and kind of wanting to increase vaccination rates in our licensed facilities. So next slide, please. So some of the goals for this project, we're really kind of advocating for tailored promotional and educational campaign and providing resources specific to our NIFs and CPCs in Oregon. We have slightly licenses as of late April of this year. And really, we want to be a resource for our facilities and provide fill in any gaps and just be an advocate for our facilities and provide any support that we can in meeting vaccination related needs in our facilities for this upcoming season. Ideally, I'd like to create a sustainable model specific to long-term care for specific vaccine awareness and education in the state. And really, like I said, just being an advocate and providing long-term care specific resources to address challenges, barriers that our facilities might be seeing. So this is something we hope to continue. It's really kind of almost like a statewide pilot that we're engaging in this year and hoping to build some sustainability and have this carry over year to year. Because really, we're not seeing as these efforts being confined to just the respiratory season. Ideally, these are going to be kind of year-round annual efforts aimed at supporting our facilities, whether this is addressing barriers with billing or consent, or addressing facilities maybe not having a contracted long-term care pharmacy or an established pharmacy partnership, or not having consistent access to vaccine supply, or having residents that may not dealing with educational needs around vaccine in their facilities. Our goal is to kind of just be a statewide resource to fill in some of those gaps. So next slide. So here's some messaging that was developed for the effort that's kind of guiding our efforts. Like I said, APD is promoting the adoption of on-site vaccine clinics for APD licensed long-term care facilities in Oregon for the upcoming respiratory virus season. We're advocating for these because they address multiple barriers to vaccination for long-term care facility residents. And vaccination remains the most effective way to minimize morbidity and mortality from vaccine-preventable respiratory illnesses in our facilities. Higher vaccination rates in your long-term care facility protect staff and residents and help your facility avoid costly disruptions due to outbreaks. So that's kind of some of the background around why we're specifically advocating for on-site clinical services. So on the next slide, I will discuss some of our efforts in more detail. So like I said, we are promoting on-site vaccine clinics. This is really kind of a statewide effort. All of our facilities are different. There are different regulatory requirements. It's very likely that a lot of our facilities have an established contractual agreement with long-term care pharmacy, with a pharmacy partner who may provide clinical services, who may provide on-site services on an annual basis for them, and that's great. I would encourage everyone to continue with that relationship. If that's how you've done it before and you have a great relationship, that's awesome. This model is essentially intended to fill in any gaps. If someone's struggling to identify a pharmacy partner, if they have barriers, like I said, we just try to compile some resources that can help kind of ease those burdens. As a part of this outreach, we have built a toolkit. So I am in an ongoing process of communicating with facilities. I sent out the initial kind of mass email to all of our facilities in the state on June 13th. And that included a toolkit of our resources, which includes pharmacies that are providing initiation fee-free clinical services this upcoming respiratory season across the state. and some additional resources, including vaccination education, some resources around how you can market or advertise your facility clinic in your facility. And so things around consent and barriers and other things was sent out. And that also included some updated pharmacy lists by county and city for all retail pharmacies in the state, and then long-term care pharmacies as well. So these resources were compiled. They were sent out directly to all of our licensed facilities on June 13th. And then I did a follow-up email blast on July 1st as well. So we've heard from a few dozen facilities. Facilities are already have already established clinics. So that's been good to see. A lot of facilities seem to have established relationships, and there's been some new ones as well. So we're here as a resource. I will attach my email address in the chat as I continue to go over some of this. So we are also hoping to do kind of a more granular facility-specific outreach in the coming weeks from some facilities we haven't heard from, to continue to support these efforts and really trying to get this messaging out there. And really, we just want to hear from our facilities. There is a survey included in my outreach where facilities have an opportunity to provide which pharmacy they may be working with and who's hosting their clinic, how many residents may be attending, and just it's also an opportunity to update their contact information for our department. So that is an element of this as well. We just want to see how many facilities may be using this kind of vaccination model and how we can continue to improve our outreach in the future. So I'm hoping to hear from as many facilities as possible in the coming months. So on a broad level, team has been working on this effort for a few months. We met with retail pharmacies across the state in the spring to get an idea of who is supporting initiation fee-free on-site long-term care clinics this year. Really, a lot of this was born out of trying to navigate the post-public health emergency environment. So there are some large retail chains that are supporting initiation fee-free clinics if the facility meets a series of minimums, and if they're in a certain geographical range of one of their locations. So we are hoping, just because of there are concerns about pharmacy capacity across the state, as you may have heard. So Oregon is second, I believe, in pharmacy access, second to last in pharmacy access. So there are concerns about pharmacy capacity to be able to go out and do on-site clinics at long-term care facilities. So we have identified the larger chains that are supporting on-site services this year. So I'll get into this more later. That is all included in this toolkit. So we are encouraging our licensed facilities to identify partners and to schedule clinics as quickly as possible because of unknowns about capacity. We want our facilities, if they need these services, to get in line as quickly as possible. So that is another reason we try to be proactive and get this out in June. So next slide, please. Well, as we're going to be pushing this out through provider alerts, we are going direct to facility, like I said, and I'm going to be following up with individual facilities that we haven't heard from in the coming weeks. I'm also hoping to involve external partners and local public health, just so we really can get this message out there and reach as many facilities as possible, like I said, with the goal of increasing vaccination rates at a facility level. So on the next slide, I'll get more into exactly what was included in this outreach and some of the resources that are hopefully helpful to our NIFs and CBCs. And like I said, we can go to the next slide. Like I said, this is really intended to help facilities overcome challenges around billing, staff time, patient consent, patient education concerns, and then administration time. We're sensitive to the fact that with staff turnover and issues around consent and billing, that this can be a significant lift for certain facilities. So that's really a major part of our outreach, is just trying to alleviate that burden on our licensed facilities. So next slide. Here, I provided a project timeline, kind of give a big picture of our effort. We're hoping, like I said, to do follow up with all of our non-responding facilities in the coming weeks here. And then we're hoping to have a kind of a good idea of all of the clinics statewide that are being hosted on site by September. And then we're just really hoping to see how big of an effort or impact this effort can make, and then how we can continue to fill these gaps in and provide these resources annually to our facilities who may need them. So we can go on to the next slide. So like I said, this toolkit that was sent out on June 13th. So this included a list of locations of chains, pharmacies that are hosting clinics with no initiation fee. So the pharmacy partner will come on site. They can help you kind of navigate the pre-clinic environment with consent and billing and getting that settled prior to the day of your clinic. And then they can bill payer, Medicaid, Medicare, they can accommodate out of pocket. All of these details are in the toolkit that was sent to facilities. And then the toolkit also includes county level local public health resources, our regional IP contact information, and then basic information about project management, tips, and staff allocation recommendations for hosting a clinic. And then, like I said, all of the information links for scheduling clinics with these kind of larger pharmacy chains that are hosting. So we can move on to the next slide. And I already went over the survey. Like I said, we're hoping to hear from as many facilities as possible. And in this survey, every facility has an opportunity to let us know what barriers, challenges they may have. And if they would like us to contact them, if they need additional support in getting vaccination access or getting a clinic set up. All of my contact information is included there, and they can request kind of a consult, essentially. So that's another aspect of this. So we can move on to the next slide. Here was just a quick mapping project. We wanted to see what the state of pharmacy access was in the state. So 99% of facilities are within range of pharmacies who will provide clinics without fees, like I said, if minimums are met across the state, which is good news. We weren't sure kind of what the state of capacity was prior to this. So a big part of this effort is, matching our facilities to a potential pharmacy partner. Typically, a minimum is around 30 driving miles. These pharmacies are typically providing on-site services for facilities that are within 20 to 30 driving miles of one of their pharmacy locations. So if a facility is struggling and finding a partner that can provide an on-site clinic, there is a good chance that there is an opportunity to kind of bridge that gap and find them a partner based on what we found. So next slide. So like I said, we have kind of large partners that are providing on-site clinical services with no initiation fee for this upcoming respiratory season. Albertsons, Kroger, Fred Meyer, and Rite Aid. We met with them and established contacts. They are providing initiation fee-free clinics for anyone who may want them and require a partner if certain requirements are met. So all of that is contained in the toolkit. Getaflushot.com is another good resource. They are providing clinics for long-term care facilities this upcoming season. And all 4 of these entities are currently scheduling. So that is good news. APD is also advocating for any facility that needs a partner to also contact their local independent community pharmacies as well if they don't already have an established relationship. Those pharmacies are very, very valuable for providing high-touch services at the facility level and really just in providing these services for their community if they can. So I would encourage facilities to reach out to their community and independent pharmacies to see if they have the capacity to provide on-site services or for ongoing vaccine services for your facility. So next slide. So like I said, currently, Albertsons, Kroger, and Fred Meyer, they serve 30 counties in our state. So there are only a handful of counties in Oregon that might not have coverage or representation from those larger retail chains that might have to, in a pinch, rely on a community access pharmacy or independent pharmacy. We have some other resources in our agency currently where we're working on outreach and for maybe rural or harder to reach facilities that need additional support as well. So it's kind of a multi-pronged effort, but we're really just hoping to reach as many facilities as possible. So next slide. And really, like I said before, we are really just hoping to leverage additional partnerships across the state. So anybody that's interested in this information, has any questions, comments, please reach out to me. We're hoping to make these resources available permanently on our website. And I will make all of that available to local public health and through provider alerts as those updates continue. And I really just want to continue to be a resource annually. So any questions, concerns from anybody, local public health facility, please reach out to me. I'll include my email address. And I'm going to continue following up with these resources. And just, again, I want to hear from as many facilities as possible and just want to support as many facilities as possible and really addressing vaccination education gaps and just hoping to increase vaccination rates for our most vulnerable residents. So next slide. So that is all from me. That is the scope of our efforts. I will continue to be in contact as things evolve, as we get into respiratory season here the next couple of months. So again, I thank you for your time. And I'm here for any questions or comments, and I will include my contact information in the chat. So thank you again.
Hi, Ryan, it's Therese. I dropped your email into the chat already.
Great, thank you.
There is a question from Catherine, and she's asking, where should we direct long-term care facilities with questions?
So direct them. Do you want me to put, so we have our APD population health email. Really, they can contact me directly. They can contact we have a general response email. It's APD population health. I can also link that email address in here. And then the toolkit also includes contact information. So I am really coordinating this effort. So anybody can feel free to reach out to me directly with any questions or if they need additional support.
Ryan, is that the apd.population health link?
It is, yes.
Okay, I'll go ahead and type that in here as well.
Okay, great, thank you. Yeah, so I am monitoring that email as well. So that would be, either is great.
Hi, can you guys hear me okay there?
Yes.
Hi, Jessica Case, Director of Nursing Services at Nehalem Valley Care Center in Wheeler, Oregon. I did have several interruptions as I was listening, but I may have missed something. So when we contact you, Ryan, if we're interested, would you help coordinate setting something up for our facility? The closest one to us would be a Fred Meyer.
Absolutely. Yeah, I mean, if you want to reach out to me, so our toolkit essentially has contact information. So we have regional contacts for all three of those larger pharmacies. And then there are direct links to where you can go and request a clinic. So if you want to reach out to me directly, I can send all of that over to you.
Okay.
I'd be happy to, be a point person and get that set up and kind of work together. So
Okay,
I can,
awesome.
for sure.
And you would also help coordinate with my business office manager, just how we can bill insurance, et cetera, if she's not aware of how to?
Yes, absolutely. Yeah, I believe the pharmacy will help with all of that. So yeah, if it's Fred Meyer, we contact with their regional.
Okay, and then my last question for now would be, is there any possibility we could also do something like this with the clinic for employees, where employees could just use their own insurance card and also get vaccinated on that same day that we had clinics?
Absolutely. So ideally, this model would support residents and staff. Again, that is, I think all of these pharmacies have they have different minimums, they have different requirements, they have slightly different methods that they approach these on-site clinics with. So that would all be hashed out and settled with your pharmacy partner. They do a good job of, if you are wanting an on-site clinic, all of that can be accommodated. So flu, COVID-19, RSV mainly. You will be able to work with your rep to get the consent established. They will bill insurance. So that can be residents or staff, really, or if family members are on site, they would like to participate as well. That can be accommodated. So it can certainly be a blended clinic in the fall that serves anyone who's interested.
Awesome. Okay, thanks so much.
Awesome. Yep, thank you.
I'll just mention, I see, I received a message from Sandra, and she says that the pharmacy, she used to coordinate clinics for Rite Aid, and she says that pharmacy will coordinate the insurance billing.
Yes, yeah, that is a huge benefit of contacting and setting up an on-site clinic. Is that that's what we heard from all three of these larger retail chains, that the pharmacy is helpful in kind of alleviating some of those burdens on the facility. That's another major reason we're kind of endeavoring to get this information out there. Is if a facility is struggling kind of under the weight of some of that billing and consent, the pharmacy can really help with that. So.
And Ryan, I had a question for you. I received an email from you that included the long-term care on-site vaccine clinic toolkit, the retail pharmacies by county, and the long-term care pharmacies by county. Would it be helpful for me to attach that to my follow-up email with the group so that they have those documents?
Absolutely. Yeah.
Okay.
Yeah, I've disseminated it to as many partners as I want to reach out to all local public health. But yeah, all of our facilities have received all of that information, but absolutely, I'd love to get it out as much as possible. So
Yeah, a lot of our public health partners had to leave early because there was a 1:30 thing
oh, okay.
to go to. But what I'll do, there's representatives from all counties in this group, so it will get out to the counties. So I'll make sure that I attach that, and then that way that'll get disseminated to the local public health.
That'd be great. Thank
Okay.
you. Yeah.
Awesome. Well, so great questions. I'm wondering if anyone else has any questions for Ryan that they're comfortable